Hello, my name is Dr. Moga. I am an anesthesiologist. I am going to list the possible scenarios for which an anesthesiologist may be called to provide care. During surgeries, anesthesiologists are called in the preoperative evaluation of a patient to determine the cardiac risk, to determine a plan of care for management of that patient. Anesthesiologists mostly will work in the operating room of major hospitals or smaller hospitals. Anesthesiologists will work in different departments of the hospital. On the obstetric floor, the anesthesiologist will manage high-risk obstetric patients by managing the pain. Any point during which a patient may need a cesarean section, the anesthesiologist is there to provide anesthetic management, medical and fluid management, and take care of the patient. Anesthesiologist will place the appropriate pain intervention for that patient, whether it is an epidural for management of pain during labor, or whether it is a spinal or general anesthetic for a patient undergoing a C-section. Anesthesiologists will manage the hemodynamics of the patients along with the obstetric. Anesthesiologists are called to sedate patients undergoing procedures such as an MRI. In any case in which the patient cannot maintain their airway, cannot lay flat, or is highly anxious and has claustrophobia, because as you know, the MRI is a long, narrow tube, and one is required to lay flat and not move for about an hour while an MRI is going on. Anesthesiologists work in the gastroenterologist suite to provide anesthesia for patients undergoing colonoscopy. That anesthetic will be dependent on the anesthesiologist's evaluation, whether the patient needs IV sedation with propofol, whether they need a general anesthetic, whether they need an intubation. Anesthesiologists are called to manage pediatric patients having dentistry procedures or other procedures such as bone marrow biopsy, circumcisions, etc. Major hospital had, of course, a dentistry department, and they would have a lot of pediatric patients who either had developmental delay or they had chromosomal abnormalities, and they could not sit still to undergo a local injection by the dentist. In that case, anesthesiologists, we would come in and intubate those patients so they could safely have their procedure.